All right, let's get started here. Hi, everybody, and welcome to our Facebook Live AMA featuring current students for our Master of Science in Biomedical Informatics program. I'm Kelsey, and I'm pleased to be your host today. I'm joined by current student Biomedical Informatics Rebecca Vogt and Bridget Anderson, who are here to answer your questions about the graduate student experience at the University of Chicago. Thank you, Rebecca and Bridget, for joining us today. Before we begin, I just want to make a note that we'll do our best to get to every question, but if we do end up missing your question, please feel free to email me at bmi-admissions@uchicago.edu. Okay, let's go ahead and get started. We already have a question. What made you decide on this program? And did you have other options that you considered?
Sure. So I'll take a stab at it. So good afternoon, everyone. My name's Bridget, as Kelsey said. So prior to starting the program in March of 2018, I had been working at a digital health company that was doing health risk assessments. And I spent a lot of time sort of doing sort of business analysis for the business, and that was sort of tied into some of my professional based background in financial services and also in manufacturing. But when it came to understanding some of the nuances related to how to read a research report, how to analyze big streams of data, and how to make sure that information that you were seeing was going to lead to improved outcomes, either in terms of health or efficiency or time, I didn't have that skill set. And if you were to be really honest with me about what informatics was 2 or 3 years ago, I probably wouldn't have even known the answer. I had heard the words big data, healthcare, data science being tossed around, things like machine learning, algorithms, and models, and I didn't really know what that meant. And so I had attended an open house, learning more about the topic, and I realized it was something that would be of interest to me.
Yeah, my story is a little bit different from Bridget's. So I graduated from undergrad a couple years ago. And during my last year or so, I became interested in data science, but in my undergraduate institution had just decided to offer some data science, at least a minor and possibly a major too. So I looked into it, but I didn't get a chance to take any of the classes. So that was kind of on my mind as I graduated and started in my current role as a research technician in an immunology lab. So then I took a little while to just work and get used to full-time work from being a full-time student. And then it was still always kind of at the back of my mind. So I decided that I might as well try it out. So I looked around and saw that Northwestern had an online program, but I knew from personal experience with online courses like Coursera and other places that online was not the best fit for me. So when I found out that the University of Chicago had an in-person program, I decided to try it out, and I ended up liking it and sticking with it.
Thank you. Next question. What's been your biggest hurdle during the program, and how did you overcome it?
I would say my biggest hurdle was just graduating in the time of the pandemic. So technically I just graduated from the program about 2 weeks ago. Thank you. And my degree concentrations in the program are in population health, clinical informatics, and healthcare delivery science. And I think I had envisioned spending the spring term going to conferences, going to happy hours, talking to people, and kind of getting a feel for like what my next big project or work assignment could be. Once COVID-19 broke out, all of that had to be facilitated remotely. So that's probably been one of the biggest changes I've had to manage.
Yeah, I think one of the biggest hurdles for me was transitioning back to full-time work as well as adding school on top of it. Just like after a full day of work sitting in class, I think Bridget can second this, like 3 hours. It can be a long day, but it's definitely worth it. I appreciated the once a week, 3 hours, as opposed to like multiple times a week for less time for my schedule for sure. So it was an adjustment, but once I got into the swing of things, it's definitely something that works out well.
So did you both work full-time and attend the program part-time? Okay,
yes, that was definitely my case. I run my own market research company, so I was doing that full-time and sometimes working with interns and then taking at least 2 classes each quarter.
That's a busy schedule. All right, well, next question. What is your dream job and how do you think this degree will help your career? I know, big question.
That is a big question. I think personally, I'm very interested in innovation and just better care delivery in the healthcare space. And so I guess for me, my dream job would just be providing some type of innovation, either to an established company or maybe even starting my own company. So in parallel to kind of completing this program, I've been kind of closely following a lot of the entrepreneurial space in Chicago by like attending workshops, going to events at Polsky Exchange, which is like a partner of the University of Chicago ecosystem. So I think for me, a dream job would be to kind of create or build something new.
Yeah, when I started the program, I've always been interested in genetics and DNA and bioinformatics. So I thought that maybe working for something like 23andMe would be in my future, and it's still definitely an option. But in the ethics class, we had a bunch of guest speakers, and one of them was from I think it was quality and safety was kind of her title. And it really opened my eyes to different ways you could work within the health system. So in quality and safety, you're kind of taking internal data to improve whether it's the layout of the room or how physicians and other providers do their workflows, or just making things more efficient. So I thought that sounded really interesting too. So that's still an open question for me.
Sure, that's perfectly fine. A lot of people don't know the answer to that question, so thank you. Bridget, I know you mentioned the Polsky Center at some point, and our next question kind of has to do with that. Have you been able to take advantage of services outside of the program itself, like the Writing Center, the Career Center, etc.?
I have. So Polsky is definitely one that I've kind of taken advantage of, and they've had a series of programming really promoting the opportunity to kind of commercialize scientific innovation. So there's 2 particular initiatives that I've done during the course of my program, and that's called the I-Corps program, where the National Science Foundation gives a small grant to teams to investigate an opportunity. So the first time I did the program, it was the fall of 2018, and I looked into innovations in kind of patient education, just ways to kind of deliver that information a little bit better. And I was able to conduct a series of market research interviews and just sort of see the current state of how this is done and where a future opportunity could be. And it was a really great project. It was fun working in a team, exploring what a new service or product could be. And then the second time I did that program, which was also affiliated with Polsky Center, was just this past spring, where I was investigating ways to conduct remote physical assessments of vulnerable populations. So it's definitely been fantastic ways to kind of put some of the theoretical ideas into action. Because I think the benefit of the program is it caters to students that are already working. So hopefully you have a lot of professional experience to kind of compare the informatics education you're getting, but also looking forward to like innovation and new ideas, kind of applying that and testing it out as well.
Thank you. Rebecca?
I actually have not used any of the other services quite yet, but some of my coworkers and other lab mates have. Like, I think one of my previous lab members did stuff with the Polsky, or one of our undergraduates had interacted with some of the 3D printers and stuff like that. So there's definitely a lot of resources that you can get access to.
Definitely. Thank you. Okay, and I know we talked a little bit about concentrations throughout the program. So do you have a BMI concentration? And if so, what's your experience been like with the concentrations?
Sure, I guess I can take that. So I have 3 concentrations: population health, clinical informatics, and healthcare delivery science. And I would say it's kind of a fascinating time to be in this program in the midst of a pandemic, because basically everything that I've learned in those 3 concentrations is applicable to the environment we're living in right now. So when you think about COVID-19, there's like distinct populations that are being affected more so than others. And you're trying to figure out what variables are affecting that. Is it socioeconomic? Is it race? Is it gender? Is it just their lifestyle and behavior and habits? So those parts become interesting from both a clinical standpoint and population health. And then in terms of healthcare delivery services, I also think a lot about, before COVID, there was just the normal practice of healthcare and like routine checkups and appointments that you may have, and what's all happening with all of that in light of COVID. And I think for some services, you're able to deliver it remotely through like telehealth or like alternative digital platforms. But then for other services, you actually need to go into a clinical setting. So it's very curious to me to see how healthcare providers sort of prioritize what they are able to do in light of a pandemic and other things that they kind of just see as less essential.
So I planned on having a concentration, but it kind of didn't turn out that way. I was going to do the bioinformatics concentration, but because I had through work gone through a bunch of different workshops and things before I'd started the program and kind of during the beginning, I found out that I kind of had the skills already to skip the introduction to bioinformatics class. So because of that, I have a feeling that I'm not going to get that concentration, but it opened up other, slots for me to take other electives like advanced programming or the population health informatics class. So even if I don't have a concentration, I'm really glad to get the cross training for other classes.
Right, absolutely. There are positives to concentrating and not concentrating. And for all of our viewers, you are not required to pick a concentration if you don't want to. If you want to take a bunch of different electives to get more of an overarching idea of biomedical informatics, then you are perfectly welcome to do that. Thank you both. Okay, about instructors now. How are your relationships with your instructors, and are they there for extra support if needed?
I'll let you go first, Rebecca. I'm answering all of them.
Yeah, as a whole, all of my instructors have been really great. Always happy to engage you outside of class. Like, you can interact with them through Canvas, which is how you do your coursework and submit assignments, or you can also, they usually give you an email address too. I usually connect with them on LinkedIn afterwards too, just to kind of see what they're up to and use them as a future resource too. But they're also just great people. They're always happy to talk about what they're working on with you. So yeah, I really enjoyed the instructors in this program.
Yeah, I would echo what Rebecca said. I think all the instructors are amazing. They're amazing in different ways. I think for some of them, they have very advanced degrees, PhDs in their areas of expertise and topics. They can give you a lot of like academic context on what we're learning. And then for other classes, some of the instructors have very practical experiences, like they work in a hospital, they are an ND, or they spend extensive time with like a provider or a payer. So I think from that perspective, it's incredibly helpful. And all of the professors definitely make themselves available with like either established office hours, or you kind of set up a time to talk to them. And then for some of the more technical classes in the program, there's often TAs as well that can help with some of the more minute details. And I know that definitely was helpful for me in some of the like computer programming and machine learning classes that I took. I spent a lot of time with the TAs asking questions.
Thank you both. How has it been transitioning to remote study for the spring quarter? I know you mentioned it a little bit, Bridget, so might feel like a repeat there.
Yeah, it's not how I had planned to spend my spring. I think especially with the two courses that I took as I rounded out my program, one was in machine learning, which is sort of an advanced computer science, statistical programming type of topic. I think for me, pre-COVID, the reason I had decided to even take that class was I really liked the instructor, just the way that he delivered the topic. It was very relatable, and just I processed it. It was a little bit different taking the class over Zoom, but I think the professor made extraordinary efforts to be available, the TA, to explain concepts. And there was even a little bit of like YouTube to help supplement my visualization needs as I was learning as well. And then the second course that I took in my last quarter of the program was in pandemics, which was actually cross-listed with the threat response management program. And that professor, Rebecca Wirt, she has, I think, an MD, PhD, and has just spent a lot of time working like in public health in Illinois and Minneapolis, I think even internationally as well. So she just brought like a wealth of experience that I thought was unparalleled.
And you said this class was with TRM students as well?
It was. So I think officially it was listed as a TRM program. So a lot of people who had very practical operational experience working like in public health or city government, federal level. And so they were able to bring an interesting perspective to threat response and pandemic management in the context of COVID, whereas we kind of came with our informatics hats thinking about data collection and how to do COVID testing and just some of those aspects as well. So I think both of the classes were phenomenal. I know they would have been amazing had we been able to be in a classroom over the spring, but I do feel like, you know, through Zoom and just even through the structure of like how the activities and the lectures were delivered, it was very good.
Awesome.
Yeah, I was actually also in that machine learning class with Bridget. So yeah, I had that professor not in spring, but also I had him in winter. So I had met him before in person, and then having him over Zoom, it was kind of like a pretty easy transition. I think the things that I struggle with online classes are if it's too flexible, like, you know, you're not always motivated to get things done, but the way that we still had class every, you know, Monday from 6 to 9. So the things that didn't work for me were kind of taken away. So it still worked really well for me. And sometimes it's almost even better because it's like you're sitting right up next to the board, so you can see really well. So overall, I think it was a pretty good transition. It was definitely unexpected, but I think everyone made the transition really well.
Great. It sounds like you two handled it very well. Okay, here's our next one. How would you describe UChicago culture? It's an interesting one.
It is an interesting one. I think it's inquisitive. It's very data driven. I think it's very collegial too. I mean, UChicago, we're known as nerdy quants, if we're being honest with ourselves. But I'm actually okay with that. And I think in my experience, yes, we're nerdy quants, but we lack some of the pretense of other sort of peer institutions. And I think, at least in the context of my program, I found people really helpful and collaborative. And I think as a student in a professional education program such as this one, I felt living and working in Chicago as I did this program, I felt linked to the broader UChicago ecosystem. So I would definitely kind of go to data science events when I needed to. I even kind of went down to Hyde Park to the library a couple of times to kind of review some of the healthcare research they had. This is pre-COVID, obviously. So for me, it was kind of fun being in that ecosystem.
Yeah, I echo a lot of what Bridget said. I definitely say like an open and questioning environment where in the sense of any questions are welcome, not like people are questioning you. And kind of like show me the data. It's something my boss always says too, like show me the data. You got to have, you know, evidence to back up your claims. So definitely a great challenging environment to be in.
Good, thank you. Do students interact with each other outside of the classroom? And what are some fun ways that allow you to stay connected with your fellow classmates since going remote?
Well, I know last fall did you go to that mixer, Bridget?
The one at the bowling alley? Yes, yeah. I did.
Yeah, so I think that's one of the few times I've met with students outside of class. I actually live like over 40 miles away from the Graham School, so it's kind of hard to like spontaneously meet up with people. But the mixer was really fun, and like I will still interact with my peers via like text or other means of communication, just not face to face.
Yeah, I definitely felt like there were definitely like quarterly mixers in our program, like the one at Lucky Strike. I know that at least twice a year there were bigger sort of graduate student like socials or formals or balls or whatever that happened as well. I didn't go to any of them, but I did see the invite and it looked awesome. And I know people that went who wanted me to go with them. I just couldn't because of scheduling. So I think that was fun. And then also, every quarter that there were capstone presentations, there was always sort of a little social and mixer afterwards too, where not only would you socialize and, have a beer or a glass of wine with your classmates, many of the professors came as well. So I definitely feel like there's a collegial atmosphere. I think those were just kind of like structured events that happen. And then I think, because there were so many like project-based projects within each class, you definitely had to like have people's phone number or like find time to meet up with them. And, after you're spending hours like working on a presentation or a project, you often want to like go have, a drink with them or grab something to eat.
Definitely. How do you decompress when class is over?
Sleeping, drinking.
Well, like I said, I live like pretty far away, so it usually takes me like 45 minutes, an hour to get home. So usually I just kind of like jam out in the car, and I found that's a really helpful way to decompress after sitting in class for a while.
Definitely.
Yeah, listening to music, podcasts too. Because sometimes I think, especially because the program, a lot of our classes were on the weekday in the evening from 6 to 9. You're getting a lot of information coming at you, and sometimes you just need a little moment to kind of veg out. So I think, like Rebecca was saying, maybe on her drive home or as I'm kind of winding down at home, you just have to take it all in.
Right, right. And what's been your most rigorous class, and did you enjoy it?
Ooh, that's a hard question.
Are you both going to say machine learning?
No, I think that class was rigorous, don't get me wrong. But I think for me, so before I got into the program, I was very unfamiliar with like scientific writing, how to do a clinical research style report. Like there's a whole language that exists within healthcare. Like if you're going to be, a professional informaticist or just someone that, is respected in the space, there's a certain way you need to kind of present yourself and communicate. So I think for me, doing the 3-sequence capstone project or capstone sequence in the program was very helpful for me, just to kind of understand how to frame a research question, how to write a proposal, how to articulate that proposal to an audience, how to receive feedback, UChicago style, like rigorous inquiry, lots of follow-up, don't take it personal. And then execute on that project, report on your findings and your results. So I think just having that whole process was very helpful for me, and it's definitely a huge part of like some of the work projects that I have now going forward. So it just gives me kind of clarity on like what to look for.
Yeah, so I'm just starting the capstone sequence. I actually haven't had any classes yet, so I can't comment on that. A little apprehensive now, Bridget.
Fine.
I think when you said about rigorous, I think either Jason Edelstein's advanced concepts in computer programming class was pretty rigorous, as well as the machine learning class was also pretty rigorous as well. So, but they were good. So.
Great, thank you. This is another coursework related question. How much of your coursework is peer or group reliant versus individual?
I would say it depends on the class. I think out of the courses that I took in the program, I think there's probably a deliberate effort by like the professors or even just how the program's structured, where there was always some type of group assignment that was like a significant portion of your grade. And I think that's important because it's reflective of how real life works and how real work is done. You can't just sort of be the person in the corner, making R code in isolation. Like you have to work with teams, you have to communicate with them, you have to schedule with them. So I think overall it was a good experience.
Yeah, I'd say pretty much the same. The only classes where I think it was only individual stuff was the 2 programming classes that I took. Otherwise, everything had a group element.
Okay, so lots of collaboration there.
Mm-hmm.
Great. Well, we are on our last question already. What is one piece of advice that you'd like to share with incoming students that you wish someone told you as you started in the program? It's a big one.
for me, I would say the time goes really fast. Like, I think when I did the program, when I started the program 2 years ago, I knew I wasn't kind of like a fast track MS candidate. I wasn't trying to kind of wrap up the program in a year to go on to a new career opportunity or go on to like medical school or something. I said, oh, I'm just going to kind of take, a slow paced effort and get this done. And then here we are 2 years later, and it's just like so much I've learned over the last 2 years. I was kind of joking with Rebecca and everyone before, but like I've made like a little matrix of like notes of like all the different classes I've took and like things and terms that I've learned. Because I think once you decide to kind of study biomedical informatics, there's a lot of like acronyms and terminology and associations that you just have to become familiar with, or be able to kind of deduce like, okay, like why am I learning this, and what is it, why is it important, and what does it kind of filter in through? So I think that would probably be my answer.
Thank you.
Yeah, mine is kind of along the same vein. It's more of like something I've learned at first, because I knew I wanted to work full time and do this program. And at first I was a little bit disappointed because I wanted to be a fast track student. But then I realized that by doing it in 2 years instead of one, I get to meet so many more people and just kind of see a different cohort every like couple quarters. You meet new people. And then also being able to apply some of this stuff in my current role, and that just further solidifies like your experience for future jobs, and it also helps you learn in your courses. So, and I mean, some of my professors know my current boss, so it's just a very small world.
Definitely. Well, that about wraps up our AMA for Facebook Live today. So thank you so much, Rebecca and Bridget, and thank you to everyone who tuned into our conversation. Have a great rest of your evening.
Thanks so much. Take care, everyone.
Thank you.